Hi, my name is Christine, and I'm going to talk to you about how to use your puffer with an aero chamber. The problem with using the puffer by itself is that the medication can hit the back of your throat instead of going into your lungs. The aero chamber holds the medication for a few seconds until you can breathe it in. You can use the aero chamber with or without a mask. The mask is useful if you find it difficult to hold your breath. To use the aero chamber without the mask, first remove the caps from both the puffer and the aero chamber. Shake the puffer at least 3 times. Attach the puffer to the end of the aero chamber. Breathe out for 2 or 3 seconds. Put the aero chamber to your lips and seal your lips around the mouthpiece. Look straight ahead or tilt your head back a little. Puff, then slowly breathe in over 3 to 5 seconds. Hold your breath for at least 10 seconds or as long as you can. Then slowly breathe out. If you need to take a second puff, wait at least 30 seconds so that you don't breathe out what you just breathed in. And don't forget to shake the puffer before you begin. To use the aero chamber and mask, attach the mask to the end of the aero chamber. Then remove the cap from the puffer. Shake the puffer at least 3 times. Attach the puffer to the other end of the aero chamber. Look straight ahead or tilt your head back a little. Put the mask to your face with soft but constant pressure so that there is a gentle seal. Puff, then take 5 regular breaths through your mouth. If you need to take a second puff, wait at least 30 seconds so that you don't breathe out what you just breathed in. And don't forget to shake the puffer before you begin. Here are some other tips to keep in mind. Don't forget to remove the caps from the puffer and the aero chamber. When you put the puffer into the aero chamber, make sure the puffer fits properly. If you have a flow view indicator, it should be on top. Always shake the puffer at least 3 times before you take a puff. Look straight ahead or tilt your head back a little so that your airway is open. Don't be like this. If you are using the mouthpiece, make a gentle seal with your lips around the mouthpiece. And remember that your teeth should not be closed. With some types of aero chambers, if you breathe in too fast, you may hear a whistling sound. Breathing in should last 3 to 5 seconds. Remember to hold your breath for at least 10 seconds, or as long as you can. Then slowly breathe out. If you are using a mask, there should be a gentle seal between the mask and your face. Not like this. Some aero chambers have a flow view indicator, which will move back and forth if you have a good seal. If the instructions on the puffer say take 2 puffs, don't do this. If you need to take a second puff, wait at least 30 seconds so that you don't breathe out what you just breathed in. To check how much medication is left in the puffer, gently shake it close to your ear. If you hear a swishing sound, it means there is still medication left. If you haven't used your puffer for a while, check the expiry date. After using your controller or steroid puffer, gargle or rinse your mouth out with water. There are certainly a lot of things to remember, So it is important to practice using the aero chamber while watching this video so that you can use it correctly and get as much medication as possible into your lungs. In order to understand why you were prescribed inhaler medications, it is important to understand how the lungs work. When you breathe, air flows in through your mouth, down your throat, and into your lungs. Once in the lungs, air flows through tubes called bronchi. Let's look at another view of the bronchi. You can see that the wall of a normal bronchi is thin, so that there is lots of room for air to flow. Now, when the lungs are irritated, usually by an infection, two things happen to the bronchi. The wall of the bronchi starts to swell and produce mucus. This is called inflammation. The outside muscles around the bronchi squeeze or constrict. This is called bronchospasm. The end result is that there is less space for air to flow, causing you to cough or feel short of breath. Although this process can happen to anybody, people with asthma or those who smoke are more at risk for becoming short of breath. Fortunately, there are medications to help you get better. The first type of medication is a bronchodilator, also called reliever, quick reliever, or rescue medication, because it relieves or rescues you from feeling short of breath. It works by opening the bronchi so that there is more space for air to flow. This medication lasts about 4 hours and then wears off. And most importantly, it does not fight the inflammation in the bronchi. So you may feel better for a short while, but your lungs may not be improving. Examples of this type of medication include Ventolin, also known as salbutamol or albuterol, and Bricanil. The second type of medication fights the inflammation in the bronchi and is called a controller, preventer, or steroid medication. It works by gradually reducing swelling and mucus in the bronchi so that the wall gets thinner, improving airflow. However, this medication works slowly. It may take 1 or 2 weeks or longer to fully work. Examples of this type of medication include Flovent, Pulmicort, Symbicort, Advair, Qvar, and Alvesco. Generally, it is important to use both types of medications, since it is easier to settle the inflammation down when it is at this stage before it gets to this stage. Having said that, some doctors may just prescribe the reliever or rescue medication without the controller medication for someone with very mild symptoms or infrequent symptoms. Now, in order for these medications to work, it is important that you are using them properly. So make sure that you review the how to use your inhaler video. You can always learn something by watching it again.